everyone, this is Sheetal. Today I am here to discuss about cancers. So we all are very familiar with this word cancer. But today we'll learn what is cancer, what are the precautions to be taken, what is the treatment, how dangerous it is and everything. So let us get started. The biological definition of cancer tells the uncontrollable growth of unwanted cells or abnormal cells in our body. So let us understand this first. See, our body is made up of trillions of cells which gradually divide and the cells that are old enough die. But cancer is something that starts when this process doesn't happen properly. What happens is some cells divide continuously, uncontrollably, and these abnormal cells crowd out the actual cells, and this makes the body harder to perform the functions normally. Okay, so this can happen anywhere in our body. So as you can read here, there are more than 100 types of cancers, including skin cancer, liver cancer, pancreatic cancer, blood cancer, skin cancer, and many more. Okay, so today we'll learn about 3 important from them, that is skin cancer, blood cancer, and brain cancer. So before going to start with this, let us learn some interesting facts about cancer. Okay. There are more skin cancer cases due to indoor tanning than lung cancer cases due to smoking. So generally due to smoking and other things like consumption of alcohol, there are more lung cancer cases generally. But due to indoor tanning, these days tanning is nothing but some UV rays are projected onto our body without getting any pain, and due to that the darkness of our skin is removed so that our skin looks bright and white. So due to this direct exposure of human skin to these UV rays can cause skin cancer. So out of 100% people who take the treatment tanning, 50% of them are identified to have been affected with skin cancer. Okay, nearly 10 million people die from cancer every year. So because it's the second leading cause of death worldwide. Cancer is something that starts inside our body. So it's not like the cold or cough that we can see with our naked eye and identify. It's something changed within the body inside the cells. So it cannot be identified so easily. So any small changes we find in our body, any symptoms, we have to immediately report to a doctor and take the treatment. Okay, about 8 lakh new cancer cases arise in India every year. And cancer was first described by the ancient Egyptians. So once most of the Egyptians were affected with cancer, but at the time they didn't know that was cancer, but later it was identified that they were affected with cancer only. So it is said that the cancer was first described by Egyptians. So let us get started with skin cancer. Okay, skin has a very important role in our body. So it like protecting from the outer environment and protecting us from UV rays and etc. So if this largest organ of our body is affected with cancer, what happens? Let us learn. So in skin cancer begins with the out of control growth of skin cells, that is in the epidermis. Epidermis is the outermost layer of our body. So this mainly happens when our skin is exposed to UV radiations that are coming from sun. Okay. There are several types of skin cancer, that is malignant melanoma or just melanoma or non-malignant melanoma, and this is again divided into BCC and SCC. First let's learn about malignant melanoma. So malignant melanoma is one type when the skin cells divide uncontrollably, that is melanocytes. Melanocytes are the skin cells that produce melanin. We have learned about melanin, right? That's the pigment which gives color to the skin is nothing but melanin. Okay, so these cells start continuously dividing uncontrollably, which leads to malignant melanoma. So this is somewhat dangerous because this can spread to other body parts also. Though it starts in skin, it can spread to other body parts and it's very dangerous. So the symptoms related to this one: unusual growth or changes in existing mold, and bigger mold, diameter, mold, color changes and all. So why are these all symptoms related to mold? Because mold is something that is produced by melanin. Okay, and treatment: surgical removal or primary melanoma on skin. The primary melanoma is permanently removed, or radiation therapy. Radiation therapy is nothing but some radiations are passed into our body which kill the cancer cells that are developed in the body. Okay? Chemotherapy. Chemotherapy is nothing but the difference between radiation therapy and chemotherapy is radiation therapy works on only some part of the body, but chemotherapy can work for whole body. Okay. And non-malignant melanoma. Melanoma is something which develops in melanocytes, but non-malignant melanoma is developed in skin cells other than melanocytes. Any other skin cells, but not melanocytes. It's mainly developed in two skin cells, that is basal and squamous or Merkel cells. So on these bases, it's again of two types, that is BCC and SCC. BCC, basal cell carcinoma. It is developed in basal cells. That basal cells are present in basal layer. They produce new cells when old ones die. Okay, the cancer develops in it's called BCC, and Golden syndrome patients are often associated with BCC. Golden syndrome is that one which affects whole our body, and that makes the patient to be more effective to some not cancerous or non-cancerous strokes. Okay, so generally who get Golden syndrome are they most likely to be affected with BCC. So early recognition and treatment are very important. Not only for BCC, for any type of cancer, early recognition and treatment is very important. This is something about the symptoms of BCC. And purely white skin colored or pink bump. Bump is nothing but some bulged portion when you see it's filled with liquid. Okay, right? A reddish color bump. It's called a bump. And treatment is curettage, excision or radiation therapy. Curettage means it's generally used for small BCC which is initially being developed. What happens in this curettage, it may be performed several times because BCC is something that may not be cured completely in only once. So it may be curettage may be performed several times. And next is excision. So what happens in excision is that some part where the cancer is developing, that is cut and removed. It is excision and radiation therapy I have already done. Next, SCC. So before BCC is developed in basal cells and SCC is developed in squamous cells. Squamous cells are present in squamous layer. They are thin flat cells present there, and here generally it's not so dangerous as a melanoma which we have done. This do not spread to other parts like before one we learned, but it should be, we have to be careful with this. The symptoms is that lung that grows quickly. Again, a symptom of lung. Almost symptoms are almost same for most of them, and treatment is laser is used to burn the SCC away. So some laser harmful radiations are used which burn that cancer cells and prevent. Okay, applying creams, liquids or lotions directly onto the SCC. And radiation therapy, this is common for almost every cancer. Okay, now I would like to call my friend Aakanksha to continue.
Good morning friends, I am Aakanksha. Now I am going to continue about blood cancer and brain cancer. First, let us take a look on blood cancer. Blood cancer is related to blood cells. How these blood cells are released? These blood cells come from the bone marrow. These blood cells come from the bone marrow. The bone marrow has a specialized cells called stem cells. These stem cells release the three types of blood cells called the white blood cells, red blood cells and platelets. First, let us take a look on white blood cells. White blood cells, they help our body to fight against the diseases. And red blood cells, when we inhale the oxygen is trapped in the alveoli. When the blood passes through this alveoli, red blood cells trap that oxygen, and the blood passes through when the blood is passing through the tissues, it is transported to all the tissues, and the tissues utilize it. And platelets. Platelets play an important role in blood clotting. Usually, when we are injured, our blood vessels get damaged, and we start to lose our blood. Due to this, we may lose the blood in our blood. For that, the platelets come together and plug into the hole of the blood vessel, so that the blood is not oozing out. Next, let us take a look on blood cancer. A cancer of blood-forming tissues hindering the body's ability to fight against the diseases. There will be an uncontrolled growth of abnormal cells, abnormal growth of white blood cells or any blood cells. types of blood cancers: leukemia, lymphoma, and myeloma. Let us discuss about leukemia. Leukemia. It is caused due to the abnormal and uncontrolled growth of white blood cells. They damage our immune system. The symptoms include fever, chills, weakness, losing weight, swollen lymph nodes and nosebleeds, and tiny red spots on the skin. Factors are radiation exposure and blood disorders and smoking. But it is we can't say confirmedly that the radiation is the particular reason for the leukemia. Doctors believe that these are the factors for the leukemia. Treatment. As we know, when we talk about cancer, tumor comes into our mind. But tumor is a clump of cells which can be easily removed and it is absorbed by through the naked eye. But in the case of blood cancer, they are blood cells. They can't be absorbed through the naked eye and they can't be removed so much easily. For this, a specialized treatment called hematopoietic stem cell transplantation is used. In this process, the stem cells from a healthy donor are removed and injected to the patient's body. These cells are obtained from the umbilical cord blood or peripheral blood of the donor. The donor may be his unrelated donor or his sibling or an identical twin. After the transplantation, the bone marrow starts to produce new white blood cells so that our immune system gets boosted. Now let us take a look on another type of blood cancer, that is lymphoma. It is a type of blood cancer that affects our lymphatic system. Lymphatic system is a process to fight against the diseases. Lymphatic system includes lymph nodes, thymus gland, bone marrow, and spleen. Thymus gland is present in between the chest. It releases a type of white blood cells called T lymphocytes. Symptoms include fatigue, weight loss, night sweats, and shortness of breath, swollen lymph nodes. Factors: exposure to chemicals, radiation, smoking, weakened immune system, and family history. For this lymphoma, rarely the surgery is used. For a lymphoma which is spread all over the organ, the radiation therapy is used. Next, melanoma. Melanoma cells prevent the normal production of plasma cells. Plasma cells are a type of white blood cells. It damages our immune system, kidneys, and bones. Symptoms include anemia, fatigue, constipation, and kidney damage, weight loss. Factors are exposure to radiation, obesity, and age. The multiple myeloma affected white blood cells are like this. They do not produce the antibodies, so that the disease can be easily occurred. Next, brain cancer. Let us take a look on basic things about brain. Brain has three parts, namely cerebellum, and medulla oblongata is the lower part of brainstem. Cerebellum performs higher functions like learning, emotions, touch, sensation, etc. Cerebellum's function is for the movement, maintaining balance, and posture. Brainstem performs many automatic functions like breathing, sneezing, coughing, heart rate, and body temperature. Brain cancer is caused due to the formation of tumors. Tumors is formed by the abnormal growth of cells in the brain. When in the initial stage of brain cancer, we can't identify any symptoms. But when they are growing, it forms a clump in our brain so that it puts the pressure in our brain nerves and on the brain, so that it causes headache, nausea, and vision problems, and gradual loss of sensation. There are two types of brain cancer, that is primary brain cancer or primary brain tumors or secondary brain tumors. Primary brain tumors are they can be removed easily and it does not show so many symptoms. But in the case of secondary brain tumors, they grow rapidly and it may cause death. Primary brain tumors originate in the brain itself or in the outer coverings of brain, such as in the brain membranes. Primary brain tumors begin when the normal cells changes in their DNA. When the DNA goes under mutation, there will be a rapid growth of abnormal cells in our brain, so that the brain it leads to the primary brain tumors. In adults, primary brain tumors are more or less common than the secondary brain tumors. The primary brain tumors look like this. Treatment. The treatment called craniotomy is used to remove the tumor. In this process, a bone flap is removed. Bone flap is the section of skull. It is removed, and the tumor inside it is removed by using a special tools. After the removal of tumor, again the bone flap is stitched into the skull, so that after some days the bone flap will automatically mend into it, and there will be normal growth of cells.